We have here our Dr. Kumar Rauniyar, and he is now working as a medical officer in College of Medical Science. And today he is going to share some experience about COPD patient, like acute exacerbation of COPD. So let's talk to him. Okay, Dr. Love, tell something about the management of acute exacerbation of COPD.
Thank you, Dr. Kumar Yadav. First of all, let's know about COPD. So basically, COPD means chronic obstructive pulmonary disease, and this disease is basically a disease of adulthood. It means it do not affect usually the children, and this disease is actually the main problem, the main thing that leads to this disease is smoking. So smoking is solely the 90% of the cause of the COPD, and it is not actually an autoimmune disease. It's actually the obstructive disease in which the respiratory bronchioles, the alveolar bronchioles get obstructed, and due to which the patient experiences shortness of breath. Basically, these are two types: chronic bronchitis and we have another emphysema. And it depends upon the patient to patient. Some patients get smoking exposure, and after this smoking exposure he will get the chronic bronchitis, but in some patient they can develop emphysema. So that varies from case to case. While talking about management, first of all, in COPD patients, usually they are taking some kind of medications, like they are taking any kind of steroid, or they are taking any kind of anticholinergic drugs, or they are taking any kinds of antihistaminics. So if they are already taking drugs, and now they again, despite taking the drugs, if they develop the exacerbation, this is known as acute exacerbation of COPD. And whenever this occurs, we will actually see the vitals of the patient. We will actually see the pulse, BP, saturation, oxygen saturation, and we will do a basic test that is known as arterial blood gas analysis. After this test and following the vitals, we will see that if the oxygen saturation is not maintained, then we have to maintain it. And for maintaining the oxygen saturation, we will give the oxygen via the nasal prong initially. If the nasal prong is not sufficient, then we can switch over to the CPAP or BiPAP. Basically, we will not give here the non-rebreathing masks or venturi masks, as it has a chance of CO2 retention. So we will basically only do the treatment of the washing out CO2 from the body, so that it will not cause the CO2 narcosis. Other, we can give the steroids in the injectable form, like hydrocortisone 100 mg. We can give TDS or QID. We can also give the